All right, welcome, guys. Welcome back to Plastic Surgery Untold. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon, and I have the great privilege of our celebrity cast today. So we got some special guests and, of course, our usual suspects. So we got one celebrity anesthesia.
What's up, everybody?
Who has been killing it on Instagram a little bit lately. So for those of you that follow, please know it's NC-17 because he does not wear a shirt. But other than that, the content's been on point.
Thanks, man. Thanks. Been trying to get after it. No days off.
Okay, and then G. Berto, thanks. A little delay getting started today as you had to do another wardrobe change, but the flower looks on point, and you're looking rather damper today.
Thank you, sir. Appreciate it.
Dapper Dan over there.
Yeah, my Instagram game may not be on point, but I do promise to keep my shirt on.
Well, we're going to get back to this because somebody did challenge you to a bet that they said anything, correct? We're going to come back to this. Don't you worry, people. We're coming back to this. Little radio trick here. We got to leave some good nuggets for the end. And then we got our special guest here, Dr. Andre Levesque, who some of you may or may not know. Actually, we were med school classmates.
Yeah, absolutely.
Well, I appreciate you joining us today.
Pleasure. Thanks for having me.
We're going to talk a little bit today about local lipo, some local procedures, including J-plasma, which is one of your specialties. But before we jump into this, can you tell us a little bit about your practice, your life, what's going on?
Sure. So like yourself, I'm here in Austin, Texas, and solo practice started about almost 2 years ago now. And actually, we're in an interesting situation because when I started my practice, I was sharing your office. And so it's been 2 years, and we've got a nice small staff that I really consider an extension of my family. And we do a little bit of everything. But my main focus is, of course, cosmetic surgery, face, body, breast, everything. But I also do reconstruction. So you may find me zipping around town taking care of trauma.
Because you were at the university hospital before, and it's kind of your side passion, isn't it? Some of the micro and other stuff, because you do some really, really cool stuff that I think you just don't let go because you like the intricacies of it.
Right. So, yeah, that was my first job out of training was at the university and got to teach residents, med students, do a lot of complicated reconstructive surgery. So, well-trained, so feel like I should still be doing that. And as long as my wife lets me keep doing that, I'm going to keep doing it. So
it's hard to let go of these skills you built for so long, and you're like, how can I just You're like, at least let me dabble. But it's kind of funny. Andre alluded to it a little bit. So I was part of a big derm group, split off onto my own, and then he was part of a derm group. He split off onto his own. So as his office was getting prepared, he lived with us for a little bit at our office. And then, as most of you that listen to the cast, we're trying to move into our new office. That's been delayed. So he has graciously taken us in as his foster child. And so I truly appreciate it. So it's been fun, and it's kind of given me some good insight. And that's why we decided to have him in here, because he does some really cool things that I don't do in my practice. And so maybe I can learn a little bit, or if not, at least let people know that these services are available here in Austin, which is so cool. And we talked about this on previous episodes, how many incredible subspecialists there are in Austin of just unique stuff in such a small town. But before we get into all the plastic surgery stuff, let's get caught up what's going on in people's life. And we always have to let celebrity anesthesia go first, or he gets upset. So please let the star bright shine.
Do not make me take this shirt off. I don't know if for the 3 people listening that don't follow my Instagram, that was a joke. I have like a couple hundred followers, not much. But this past week, my wife tasked me on. I had a full day off, so of course my honeydew.
Oh, so like
list,
every Monday, Tuesday, Wednesday? Or?
No, get out of here! Get out of here!
Okay,
I'm doing
good.
your cases on those days. On my honeydew list is piling up. First thing on there is you have to take my car in to get this little oil gasket thing repaired. I'm like, okay, cool, no problem. I show up. We trade cars for the day. She takes mine. She goes to see her home health patients and all that. And I pull up to the dealership, and I realize that there is not a mask to be found in the entire place. So I go back into the car. I look. Mary has taken all the masks out and put them in my car so she can see patients. The only thing I could find is a mask that she was handed when she went to the nail place a couple weeks ago, which is a faux Louis Vuitton, over-the-top gaudy, big LV, bright.
I hope there was some bling on it.
Oh,
I hope there was some bling.
It was just barely short of being completely bedazzled, man. It was ridiculous. So I put it on, and because I don't have any other option.
How did that not make the gram?
Oh, it did. Oh, thanks for watching.
Oh, my
Who is
bad.
thi-
I'm gonna take a my bad on that
gosh.
one.
Anyway, so I walk in, and of course I'm in this ridiculous mask. They offer to drive me home because I don't have a rental car available. I'm like, okay, no big deal. I'm on the way home with this guy. He's probably, I don't know, 20 years old, driving me back to my place. And he's like, excuse me, is that a real Louis Vuitton mask? And I go, yeah, man, honestly, best $1,200 I've ever spent. I felt bad, and then I lied. I told him it wasn't real. But.
That's incredible. It's funny how this whole mask thing has taken a life of its own.
Oh,
but,
my gosh.
But, not to get too much in the mask. And maybe I maybe jump in front of one Gilberto here because I feel like my life entails, Gilberto's life.
Please.
So recently went to go visit my mom for her birthday, just did a little day trip. And so went out on a Saturday, came back on a Sunday. But I'll tell you, I somehow talked one Gilberto into come into the land of enchantment with me to see where I grew up. And so we got tickets on a Friday night and left, I think, 6 hours later on a Saturday morning in the end. But traveling with Gilberto is not traveling like a normal person. I mean, he does baller style. So first of all, we get on the plane, and then they go, hey, I'm sorry, we're going to have you guys get off the plane because there's a gas leak.
Oh, God.
Seems reasonable. Get off the plane.
Yeah.
We weren't going to make our connection. We're only going for one night. So Gilberto's like, let's go to the lounge. He's like, I'll just ask my peeps. I was like, I didn't know you had peeps at the airline, but okay. We go up there. They change us airlines, get us on another flight that gets us in at the same time through a completely different airline company. And I was like, I didn't know they do that. Baller move number one. So then we're back home. And so we go and we're at dinner, and so we took them to some place here in Old Mesilla, see a little old school stuff, and they have these like red piranhas. And so Gilberto, being the baller he is, decides he's going to try and pet these little piranhas. Oh. And I was like, holy shit, dude.
What could go wrong?
I don't think you're supposed to stick your hand in there. And so somehow I think he still has 10 fingers. We may have to do a little count here, but he's doing well. So then we're coming back. We took the red eye to be here for this podcast. We actually flew in today, back here, boom, boom, boom. We were in New Mexico this morning. We were running a little late because the flight was at 6 in the morning. We had to drive an hour to the airport. But so the line's out the door, and he's like, nope. He's like, we got a back entrance. So we go to this side thing, go right up to the front, and the lady waves us up. She's like, most beautiful man, come on up here. Here's your ticket. Then we're going to check into the gate in El Paso's this tiny little thing. And I'm going to the line like a sucker, and all of a sudden he's like, John, we don't stand in line. We go around the side, and again, most beautiful man gets waved through. It's like, come on, most beautiful man, come this way. And I was like, holy shit. I was like, what it's like to be Austin's most beautiful man.
Traveling with Big Daddy
Gilberto. And then we're driving home because I'm driving him like his personal chauffeur to his house to drop him off. And so from the back seat, he's like, hey, I told this girl that I pet a piranha, and she didn't believe me. And so I said, the bet's on, and she said, I'll bet anything. So I just want to see where that got left off.
I had to show proof of said hand in piranha tank.
But what was the bet? I mean, I feel like you've left us cliffhanging, and you're playing a little cat and mouse with us right now.
Did you cash in?
That's exactly what I'm doing, John. It was quite the weekend for sure. I think the only thing I was missing was a bedazzled Louis Vuitton mask.
That's it. That would have sealed the deal.
Yeah.
Okay, we'll keep moving since it sounds like Gilberto's not going to tell us the epic conclusion of this story here. But let's talk a little bit about liposuction under local anesthesia and some G plasma stuff. As some of you guys know, I do a ton of liposuction, but I typically need the services of one celebrity anesthesia, and it's a common question that we get in our practice, whether they have to be asleep, whether you have to do anesthesia, and so maybe we'll let Andre take over a little bit and kind of tell us how in your practice you decide who needs, because you do stuff under anesthesia, and you work with celebrity anesthesia as well, but how you decide who you do in the office, who you do at the surgery center, and maybe kind of pros and cons?
Yeah, absolutely. So, not everybody is going to be a good candidate for liposuction in the office versus under anesthesia. And a couple things you look at really is, what's the anxiety level of the patient, and what areas you're going to work on. So a lot of it has to do with mostly, how much you're going to do, which areas, because certain areas are going to be a little bit easier to take care of, say the neck, submental liposuction, easily done in the office for most patients. You start doing some of the bigger body areas, certainly things that you're doing, Johnny, is Brazilian butt lifts. That's just a lot more areas. Very difficult to get people numb where they can comfortably undergo the procedure in the office compared to surgery center. So, Celebrity is going to help you out there. And that's exactly the same reason that I do the procedures that every once in a while I'm doing Brazilian butt lifts. And so Celebrity helps us out there. So, certain areas, back, difficult to get numb. I think abdomen in somebody who's a little bit on the smaller side, perfect for the office. Arms, submental, chest on some men would be a good place as well. So a lot of it just depends on, is the patient amenable to that? Because you can certainly offer it and they may just freak out and say, absolutely not. I don't want that. I don't want to hear. I don't want to see. And we're going to sleep. And that's fine. The reasons to do it, of course, are number one is safety. If you do not have general anesthesia, then you don't even have to worry about that part of it. So no offense to Celebrity there, but it is a safer option when it is going to work and you get your goals. And then,
can I stop you on that part? Because safety, I think, is a huge one, because I think there's some big safety benefits to not doing general anesthesia. But I think we've also seen people, because you've already alluded to some of this, that there's certain areas that you can get better numb than others. The amount of areas that you're doing in one setting.
Of course.
Because sometimes people get themselves in troubles by trying to either over numb people because there's a limit to how much lidocaine, or trying to give people too much sedation in the office because you're doing too much. And so do you want to guide us a little bit about how you decide kind of your cutoffs and what's keeping that in a good, safe spot?
So I think, the way I look at it from a wetting standpoint, when we're doing tumescent anesthesia, typically you're going to inject a little bit more compared to when you do it under general anesthesia. So I'll typically go less than 3 liters is kind of where I cut it off. Now, under general anesthetic, I'm usually shooting for less than 5. And those are kind of well studied, mostly based out of Florida, as far as what could be considered safe. You also have to worry about fluid shifts. So if you are doing larger liposuction, you may need to have an IV so you can give the patient some fluids, make sure you're not getting them dehydrated. And then you bring up the right point about, we do give a little bit of medications by mouth. And so it's always a balance. You don't want to give somebody too much in a setting of my office. We don't have Celebrity there to kind of rescue us. So we're always paying attention. And we do, in fact, have all the things you need, airway, all the rescue drugs in our office, or else we wouldn't be doing it because that wouldn't be safe. So, that's the key when you're looking at providers that are doing this. It's really, are they ACLS certified? Do they know what to do if there's too much medication? And there's providers that are doing some nitrous oxide and all these other things. So it's more about making sure you got good history, good physical exam for the patient, so that you can give them medication just to get them comfortable. And then once you get them numb, then it's really not a problem. So. But I do think you do need to be wary about it, and it's not something you want to be cavalier in any stretch of imagination. And if you do need to be more aggressive, then definitely general anesthesia is going to help you do that.
Absolutely.
It sounds like you're super selective, though, because especially stuff like a neck, I think that's a great one, because that's a very isolated area. That's not going to be a huge volume. But necks is one of these where you can do a little lipo or a little J-plasma, Renuvion, skin tightening, and make a huge difference. Even if you only take 30, 40 cc's of fat out, between that and the skin tightening, it can be a huge difference. And you may only use, you tell me, 200 cc's of wetting?
I mean, for a neck, it'll be anywhere from 100 to 200, for a typical patient. And so that's really not a big deal at all. One thing I have found is when you do use more wetting, there's epinephrine that constricts all the blood vessels. And so you tend to use a little more than if you're on general anesthesia. So the bruising is actually less. You do have to take it into account when you're doing your liposuction, that there may be a little more swelling just related to the tumescent that you've injected. So your endpoint may be a little different. So you take that into account. We add tranexamic acid to all of our wetting solutions, which also cuts down on bleeding and just helps with the bruising aspect. So it's really lunchtime lipo, especially for, a neck. And so, that sounds kind of gimmicky, but that's definitely the case for small areas like that, or arms. Arms is another great area where you can, really get somebody comfortable and, do the arms and do J-plasma and tighten everything up. And I've certainly seen some patients in the right age range with not too much extra skin, where you thought maybe you'd have to just do an arm lift. You can just do liposuction J-plasma and there's no scars. It's fantastic. So you do need to be selective, but it's nice to be able to do that. I will say that, as a surgeon, you first time you start doing this, you're a little bit wary because you're like, are they going to feel this? Am I going to be able to do this? Worst case scenario, you can't get it done, and you just have the patient get scheduled with Celebrity, and then you proceed. So I don't think you burn any bridges that way. It's just a matter of selecting the right individuals, and we haven't had any patients that just can't handle it and freak out, but that's part of the interview process, and presenting them that option.
And I feel like we get a pretty good sense if somebody's just like, look, I don't want to be awake for this, I don't want to do it, then that's fine.
You go to the surgery center.
Yeah, and that's easy, and that's something that people can be upfront with us. I 100% agree with you, and not to get us off tangent, but I'm a big fan of the J Plasma Renuvion as well, and before it, there was just this big gap. So there was the healthy 20-year-old that just had a little excess fat in their arms, but had great skin that we're going to do fine with just lipo, and then there was the people who had gastric procedures and have skin hanging down that are great arm lift procedures, but it's all those people in the middle that had borderline skin, their arms were a little thick, and it's like, what do we do with these? Because you're terrified to lipo them, and then their skin doesn't retract. And so I feel like now that's a big group of people where, I don't know about you, but in the past, I was just sending them home because I was afraid to make them worse.
Absolutely. I mean, the scars for arm lift, they're impressive. And so if the arms aren't really, symptomatic, it's more of a, rashes and things like that after a bypass, then those scars are worth it. But in the person that is, a little bit contours, but the skin isn't super tight or their 20s, then you worry about liposuction. So Renuvion and J Plasma, those are great additions to kind of help a larger range of patients. And I find myself, not shying away from those patients like I may have done before, where I was like, I don't know if you really want an arm lift, but now I'm like, hey, great, we can do liposuction in J Plasma, and we can even do it in the office. And so, it's a matter of, it's a little convenient for them. We don't have to mess around with surgery center scheduling. It's really pretty impressive, and that's not the only thing we're doing. I mean, we do a lot of other things in the office, but it's all patient selection, and it's not to say that Celebrity services aren't fantastic, because they are. They really are.
But if you can space out those visits with Celebrity a little further, I see what you're saying. Celebrity doesn't need another Porsche.
Oh,
he's on his third one already. Mary's got her, workroom. She hasn't even gotten a shout out today. She's doing so well. So it's just, you can tell things are rolling. I mean,
I'm just trying to keep up with you, man.
Do you, or Gilberto's, we found out today. God. I mean, traveling with Austin's most beautiful man has its perks. It's just like, you get waved on through. Come on this way.
But to touch on what Dr. Levesque said, I think he hit the nail on the head. It's all about patient selection, surgical, selection site, the volume of lipo that you're doing. And then, the only absolute 100% contraindication to doing that is if a patient doesn't want to be awake and they're refusing, that local anesthetic, then of course, we can go to sleep for it. But I'm a minimalist, and I believe less is more. And I think that sometimes that is the safer thing to do, like you did touch on. And I don't think that general anesthesia is unsafe, but, with anything, it does carry risks.
I 100% agree, because, and we're talking about, and you can correct me if I'm wrong, Andre, but you're not talking about the people like our BBLs where we're doing 5 liters of lipo, 1,300 cc's of fat transfer. Like, that's not an office procedure.
Right, no, and you'll see me right there with you doing it with celebrities. So, I mean, I'm not doing that in my office. And, it could be that you stage it. Maybe somebody wants their abdomen done, and you can do that in the office, and then you'll break it up and do the flanks, So it's a matter of how much you're doing at one time. And it's the same with general anesthesia. If you have a patient on the table for 8, 10, 12 hours, that's adding risk, risk with anesthesia, with DVTs, PEs, all those things. So,
absolutely.
It's just being safe, not being a cowboy about it, because, we're doing elective surgeries, and we can't have any complications, honestly. So
that's right.
It's a lot of pressure. And I think, I love the whole neck lipo, J Plasma under local, because in this day and age of Instagram, Facebook, Zoom, webinars, I mean, I feel like we're not on a webinar or YouTube, Plastic Surgery Untold, Austin Plastic Surgeon, podcast. Any of those are great places to see yourself. But, if you're looking for something, but it's interesting because we're our own worst critics. And it's interesting if you don't have to go to the surgery center, if you don't have to get a clearance, because tell me, if you're doing it under local, do you still make them get a cardiac clearance, a clearance from their PCP, those type of things, or not necessarily?
Really not. And the way I see it is this, we're not giving them a induction agent, which really drops their blood pressure, which can stress a heart and cause issues. So, really, we monitor their blood pressure. We're talking with them the entire time, and we've got pulse oximetry. So, if they get a little deep, we just say, hey, how are you doing? And if they're getting too deep, then you have ways in which you can augment their airway or reverse the meds so that you can get them back into a safe place. So it's really about paying attention and just all hands on deck when we're doing it. With general anesthesia, the celebrity's taking care of that. So it's just one more thing that, you're paying attention to with a dedicated person on your team. In the office, you're still doing that, but the medications we're giving are nowhere near as strong. So I don't stress about it. I still do, worry about some of the medications, the blood thinners, things like that. You don't want to have any bleeding. But it's definitely a different level of anesthetic where I don't worry about stressing the heart.
How about celebrity anesthesia? And I have talked on multiple episodes here about like the whole ERAS protocol, getting people started on Celebrex, gabapentin, some of these other things ahead of time.
Yeah.
I'd like to get you and celebrities' opinion on that. Is that something that you still do with the local cases in the office, or not? You haven't found that as necessary?
I have. I still do that for the larger procedures that we're doing. So, I do facelifts as well in my office under the same circumstances. So for those patients, I'll definitely have them with the Tylenol, gabapentin, Celebrex. Celebrex I will sometimes hold off on the open neck procedures that we do just from a fear of increase in bleeding risk. But I think that's all important, especially if it's given beforehand as it's supposed to be done. Then before I'm even injecting, the patient's already in a very comfortable place. So it's all about, not having a painful stimulus where the brain will sense that something's off. So, if you can get to that place where they're numb, they're just going to have so much better experience. And blood pressure is not going to go up, which means you're not going to have as much bleeding, less bruising, easier recovery.
And when you're given meds, correct me if I'm wrong, but your main goal for those procedures is anxiolysis or decreasing those patients' anxiety, because that local anesthetic is theoretically taking care of, like you alluded to, the blocking those pain pathways. So that brain's not even understanding that you're cutting on the face or cutting on the neck or anything like that, because those signals aren't being transmitted. But if you need to give them anything, you can give them a benzodiazepine or something at a lower dose so that they are comfortable and you've decreased their anxiety.
That's right. Absolutely. That's the biggest medication that we're giving is the anxiolytics, the short-acting benzodiazepines to be specific. And that'll just get patients in a comfortable, compliant place so that you can go ahead and get them numb. And once they're numb, we've had patients wanting to watch the procedure and things and say, hey, can I film that, or can you film it and let me watch? And I'm like, well, I don't want to be distracted with that, so no. But yeah, technically they could totally do that. And I've done other procedures, just hand surgery where people are literally watching me put their tendons together. So it's certainly, impressive when the medications are given, what we can do. I can't imagine the times before we had these medications. I mean, imagine Civil War times. This is crazy.
Half a bottle of bourbon and a bullet.
You're bite down on this.
Somebody's leg off. Yeah.
But tell me, you can still do a lot of the things that we do under general anesthesia, because you still do some small fat transfer, like you're doing fat transfer with your facelift or to the lips or something like that.
Oh, yeah.
You could still use like the PALS, the power-assisted lipo if you wanted to, and so forth, correct?
Absolutely. Pretty much. Things I think you can't do effectively, in that situation are, your tummy tucks or your deep muscle work, breast implants under the muscle. That's just going to be a little bit too nauseous, and trying to get the patient numb at that level is incredibly difficult.
I feel like the gauntlet's been thrown down to one celebrity anesthesia. Challenge accepted.
Yeah,
we'll see.
Let's do it.
Let's do some blocks. Do some implants.
On my way.
I mean, if I just listen to this, I feel like we're gonna have to help celebrity anesthesia write his Indeed profile. He's gonna. What other skills do you have, celebrity, that we could do? I mean, you're a photographer. You're a limo driver.
That's right. I'm my wife's manager, all that good stuff. She manages my account now, so it's great. It's great. You can find her at Your Trendy Therapist.
There it is.
There it was. Plug number 3,860.
How have you found the recovery has been for your patients without the anesthesia? Do you feel like they get going and get back up a little bit? I guess it's twofold. I guess the procedures tend to be a little bit smaller, which is helpful for them.
Yeah.
But also not some of the anesthesia effects.
Yeah, definitely. With a general anesthetic, there is a sense of a fatigue. I've personally experienced that with my own surgeries, but you get a little fatigue, a little bit
His
off.
calves are on point for those of you that are wondering. They look good.
Yeah, so I'm really yeah. So absolutely, the patients recover fast. I mean, honestly, if they didn't have benzodiazepine, they could literally drive themselves home, which we don't let them do that, of course. So they can go home, and after the benzos are off, they feel great. And the bruising is minimal. So the nausea is also a big deal. The patients are not having nausea like they would in patients that just are prone to that from a general anesthetic. So all good things. I feel like I'm just bashing anesthesia.
Oh,
That's
man,
not the case.
More chest pain.
Yeah, no, so I mean, you'll see me there just as much as I can. So it's not I don't not do general anesthesia, but I think for the right patient, it's a powerful tool to kind of get you the results that patients are looking for. And there is definitely a fear just of many patients of going to sleep. I mean, I'm sure you've come across that too. Is people are just scared of anesthesia.
Half of my job is talking to people in the pre-op area and doing some education, talking to them about the real risks and what is associated with general anesthesia. The fact that I am there the entire time, I am not doing anything else. I don't just put you to sleep and then walk out for the 6-hour case, then come back in to wake you up. That's not how it works. I'm there for the entire time holding Franco's hand. So
I need a lot of help here in this procedures. Gilberto used to be part of these procedures, and he said that his back got hurt, from helping me the entire time. So
it was more about me carrying you, John.
But and then you alluded to it a little bit, Andre, before. So lipo is definitely a big one and kind of the focus of today of things that we can and can't do at the surgery center. But you do a lot of other cosmetic procedures there and stuff like I've seen you do some upper eyelids and things like that as well.
Yeah, we keep expanding that. Honestly, because of our experience, the patients have done so well, and we're more comfortable doing it. So I started doing my facelifts probably about 2 years ago, right when I started the practice, and I haven't done a facelift under a general anesthetic. Sorry, Travis. In that time. So it's been in the office, and the reason you can do that is, on the face, there's specific nerves that can be blocked very easily in very predictable areas. So that's a very easy thing to do. I think you got to have the patience to kind of learn the technique and also understand that you're going to be speaking to the patient. There's plenty of surgeons that, prefer not to speak to the patient while they're working. And that's fine. So there's nothing wrong with that. So
and PAs that prefer not to speak.
But yeah, facelifts, we do our upper eyelids, lower eyelids, and those are the big things. We've done arm lifts in the office, liposuction, all sorts of things, and just looking to expand that, not go to the surgery center, but just to give more options to patients.
And I think every anesthesia professional that's listening to this podcast is just cringing when I'm going to say this, but I actually agree with you. I think that at the end of the day, it is all about what's best for the patient, right? And if it's better for that patient's budget, if it makes that patient more comfortable to have a small area worked on at a time instead of doing 5 liters of lipo under general anesthesia, maybe that is the best tool for them, and maybe that is the best path of treatment for those patients. So I totally agree with you, man. I think if you have them comfortable, which you always do in your office, and you've got a good protocol and you're following all those safety measures like y'all do, I say hats off to you. That's awesome.
And I think this is where it goes back to the initial consultation. And we've talked about this on so many topics here in terms of, what are the patient's goals? If they're thinking that you're going to get 5-6 liters of lipo, this isn't the case. If they come and say, hey, it's just this little bulge here that drives me crazy, then you're like, oh, this is a great candidate for some stuff like this. And so I think trying to find a good, happy spot. And this is where, you do like I do, where, we have people come in and just talk about what are you hoping to achieve? And so we can be on the same page about what's real, what's not, and maybe for them they'd rather come in 3 separate times to lipo different areas and then do it little by little. And if that's what's best for their life, then great. Then that's probably a good place. We get the other extreme sometimes where people want to do 42 procedures in one day, and we have to be like, that's it, no more procedures, no more add-ons, no more one more thing, nothing. We're at the limit, and it's our job to help guide people and keep them safe one way or the other.
Yeah, absolutely.
Gilberto, I think I threw you off a little bit about your anything bet, but I'm just trying to see if you're still with us and what's going on, and just catch us up here. I even took a little Instagram picture of you right now to post just this awkward moment of silence. What's going on? Some thoughts?
No, this is all really interesting. I'm curious, like you mentioned submental fat liposuction and skin tightening. Could the same be done for other areas that are trouble spots? Like I know I get some patients come in that ask, what can you do for this little pocket of fat where my bra's at that kind of collects? I mean, I would imagine that's something that could be done in the office as well. Wouldn't you say, Dr. Levesque?
Yeah, sure. I mean, if you can think of an area that Kybella markets to, you could do the same thing.
Yeah,
so,
sure.
I mean, it's definitely the upper outer part of the breast. You got lower portion of the buttock, banana roll areas.
Yeah.
The smaller areas are just easy to do. And you can use even smaller cannulas than we're using in the surgery center. So the scars are really a non-issue. So it's definitely just, getting the word out that, hey, these are areas that could be treated Kybella, could be treated with liposuction. It's just really just how you want to get there.
And
are you guys Kybella fans? Not to put you on the spot here, Andre, and then we'll come to you, Gilberto.
Yeah.
Oh, go ahead.
Well,
Everybody wants to take a fifth on this.
Well,
it's
for
fine.
me,
Don't upset Allergan.
well, for me, it's the only option I have. I'm not trained in liposuction, so it's the only option I have. I think it does an okay job. I don't think it's clearly not as good as having a full liposuction procedure. But for those patients that maybe are a little surgery averse and want to just give it a try, I think they do. It's for a specific patient, I think. But I do see some improvement.
Andre?
I mean, for me personally, I'm going to lean more toward liposuction just because I know I can get a faster result with pretty minimal downtime. I consider them to be pretty close because, Kybella does create a pretty substantial response in a lot of patients.
Yeah.
So that's my preference. That's not to say I haven't done Kybella. It's just I do liposuction.
Yeah. I mean, I get some people that want it. They just don't want a procedure, and I get that, and that's fine. I think with Kybella, just really being upfront with people about how much volume it actually takes. It takes, I think, more product than most people think.
Yeah.
In a few sessions.
And a few sessions.
Yeah.
Agree.
Yeah.
Spaced over
months.
over time.
Yeah.
And so I think, if you're looking for a quick fix overnight, it's not a magic bullet. So it's just trying to be real with people about that.
I probably refer more patients to Dr. Franco for localized liposuction than I do Kybella, to be quite honest. I mean, I'll do it, but I just, like I said, it has to be a specific patient type.
Yeah, it's like everything. It's figuring out what their goals are, what they're trying to get to, trying to be upfront about budgets. And I think it's something that everybody else wants to skirt around and not talk about. But, I mean, there's always some cost involved, And for those of you that know Celebrity Anesthesia, he's not cheap. He's not. And so, this could be a cost saving for people along with convenience. I'm sorry, Gilberto?
Oh, no,
I did my Johnny Manziel shout out right there. In the spirit of football season, we're finally back.
What other big kind of points would you say in terms of if people are trying to consider whether to do something, liposuction under local anesthesia? Because even here in Austin, there's several practices that do a lot of liposuction under anesthesia, some that don't. And I think I'll give you my 2 cents, and I'd love to hear what your thoughts are. I think it's just all about what your goals are and being very realistic about that, and I think, unfortunately, from a downside, I see people who got BBLs under local, and they tend to just feel disappointed that they didn't get enough fat out, they didn't get enough fat transferred, and I think more than, and I really don't think the surgeon did a bad job. I think there wasn't a clear, course of action between them in terms of, hey, look, here's really kind of the limit of what we can lipo for you under local anesthesia and what we can transfer. And I think that somehow just got lost in the communication, and it wasn't like that they didn't do a good job, if that makes sense.
Yeah, no, I've certainly seen that as well, and I think today's age with Instagram and favorable positioning of photos, the demands
That's a very kind way to say that, Andre.
the demands for our results just get tougher and tougher, and so I think if you're going to be aggressive, I think you got to have a general anesthetic. At least that's been my personal experience as well. If you're really looking for that snatched waist, and Instagram famous, you're probably going to get a more aggressive result if you're asleep. And so that's how I kind of approach it. What's the specific anatomic part? Am I going to be aggressive enough? And how's the patient going to handle that? So, you certainly don't want to be in a situation where you're just not able to deliver the result that the patient wants because of the anesthetic that you've chosen. So I do feel that that's the biggest part of it, is really just kind of picking and choosing, what the results are going to be and what the expectations are. But that's just plastic surgery in general.
And social media has made it, I'm a big fan of it, obviously, and any of you that follow Celebrity have seen that he's become a big fan of it over the last 2 weeks. And so it's been a pretty amazing how it's been able to take the black box out of plastic surgery. But on the flip side, a friend of mine in LA does this fake versus reality, because it's just amazing how many pictures are photoshopped, angles, airbrushed, and don't realize, trying to help patients be like, hey, that's not real. That's not doable. I mean, there's so many times people bring pictures in and I'm like, I can't do that. And they're like, what do you mean? I was like, I just can't. And I don't really know what else to say other than I can't. One of my all-time favorites is somebody brought in a picture of someone who'd had a BBL, and this was done outside of Austin, so it wasn't one of the incredible plastic surgeons here in town, but someone had photoshopped their pictures, didn't realize that they had striped walls behind the patient. So when they edited the picture to make their waist smaller and their butt bigger, the striped walls were curved too, which was absolutely phenomenal in the before and after. And it's just kind of like, oh, okay, that's not helping the world.
I didn't realize how far down the rabbit hole we had gone in these filters and everything until me and Mary were in the car the other day, and she's doing an Instagram story at Your Trendy Therapist, and she turns it over to me, and I look over, we're at a red light, and I am the tannest I have ever been in this photo. I'm just like, how did I get that tan? She's like, oh, it's my favorite filter.
Wait, you're crushing my world. Mary does a filter?
Only for tan.
What?
Only for tan, not for snatched waist.
Right now, my world has been shaken. I thought Your Trendy Therapist was just like that.
Just naturally sun-kissed all the time?
You just gave away all of our
I know.
I'd rather you guys use a filter than actually try and get tan from a dermatology perspective.
That's for you, man. We're doing it for you.
Thank you. I appreciate that.
Hashtag no filter.
Yeah.
It's the new movement.
Right.
What other take homes would you like for us to take home for people out there listening and trying to decide, how they want to go about their liposuction or J-plasma Renuvion treatment? What are a few key points or questions you would have them ask their physician or to think about when they're trying to decide whether this is something they want done under local, under general, and at some point I think you have to find a physician you trust and kind of go with them, because having somebody do something they don't do on a regular basis is probably not a great idea either. Maybe if you can touch on all those things.
Yeah, so I think number one, you got to make sure that the surgeon you're going to is board certified in what they're professing to do. And so, there's a lot of different providers that are capable of doing cosmetic surgery, but there's certainly some providers that are are maybe not entirely honest about their credentials. And so you start there, do your research. The good place to find it is just the Board of Medical Specialties and see what kind of certification they possess. And then really it's about, what the experience is with the consultation. Are you comfortable with that surgeon? Are they going to take care of you if there's a complication? I think that's number one is really just a feel. If you feel comfortable, everybody knows what it feels like to be sold to. And so, I think that's one of those things where you got to just kind of, make sure that the alarms aren't going off and don't worry about the price or anything. That can all be looked at later. It's really about the comfort and is the surgeon really going to be able to deliver the results I'm looking for and safely? Because, you're doing elective surgery. This sort of stuff is not cheap, and it gets more expensive if there's complications to try to correct that. So, looking at what their results are, what the reviews are, all that goes into the research. And then certainly if somebody's telling you that they expect that, I can achieve this result in a general anesthetic, and you're pushing them to go do it under local, maybe that's not going to be a good fit because, we're all going to suggest what we feel most comfortable doing. And so you don't want to put somebody in a position that they're not comfortable, certainly when they've got a scalpel in their hand. So, I think there's plenty of providers that can do it, under local anesthesia. I also like to see the providers that can do it under general anesthesia as well, rather than the folks that only can do it under local anesthesia because maybe they don't have privileges in a surgery center. But that's another topic.
What's the old if the only tool in your toolkit is a hammer, you're going to get a hammer. And so it's nice to be able to see some other options and get some perspectives and so forth. And so interesting in terms of that. So I think the point about making sure people are credentialed, whether you're doing this under anesthesia or local, is super important.
Yeah,
very, very, very. Celebrity, any take home points from you?
I mean, not more than, what we already kind of touched on. Just make sure that if you are going to a place to have stuff done under local anesthesia, a local does not, most times does not mean that you're just getting one injection of lidocaine. That means that you are also going to get either some version of conscious sedation or you're going to take some oral sedation. So just because it says local anesthetic doesn't mean that you won't have some type of sedation or anxiolysis. The other thing I would say, just make sure you go to a place, if you are going to go somewhere where local is performed, where, like Dr. Levesque talked about, his office has a plan for emergencies. They have a crash cart. They have, admitting privileges to hospitals. So, just go to a place that you vet and that you feel comfortable with.
And I think both you and Dr. Levesque had brought this up that, just because it's called local doesn't mean that it can be benign completely. And so, there's a healthy limit, and we all know, here's limits of lidocaine based on your height and weight and BMI and those type of things, because there's specific milligrams per kilogram that people can get, and depends whether you do epi and depends whether you do tumescent. And so beyond the scope of this, but those are things that we calculate ahead of time to know where we can get to. And that's why he has some general rules about what he does and doesn't do is for those, and we adjust those.
Yep. And to add to that, there's also, at least in Texas, there's a certification that you have to sign up to be doing this legally, which is the office-based anesthesia, and there's different level categories. So when you're doing oral sedation, that's a level 2. If you're adding IV sedation, level 3, general anesthesia level 4, and those all have different requirements. You need to have an AED, you need to have somebody trained in ACLS, rescue drugs. So those are all things that, certainly you could ask that at the time of the consultation. And if somebody gives you a straight answer and says, yeah, you want to see my crash carts right here. And, so, if somebody's dodging that question, then maybe that's a sign to, hey, look somewhere else. So, those are all things that are a little bit uncomfortable, asking somebody what their credentials are, but I think it's totally legitimate.
I mean, like you and I don't mind if somebody asks us if we're board certified in plastic surgery. I mean, that doesn't offend me at all. I'm sure it doesn't offend you either.
Absolutely not. I think that's only smart for prospective patients to really be, checking.
Totally.
Gilberto, anything to add or questions that you might have thought of here?
No, I just feel like I learned a lot about in-office procedures. I do some in-office procedures, but it's nothing like what you guys do. I'm usually excising moles, or I'm excising skin cancers, cysts, like benign stuff, and that's done under local anesthetic. But this is on a totally different level, and it's really interesting to see what you guys can do.
But you do some of the same too, because there's a limit to how many benign or how many excisions you'll do in one setting, because again,
Right.
it goes to the limit of how much local you can use, how much people tolerate being laying still
Oh, yeah.
for a certain amount of time. And so you guys have protocols in your office too, though.
Absolutely, yeah. I mean, we try. Me personally, I try to limit procedures to maybe one excision at a time. Even if a patient has multiple skin cancers that need to be removed, I may schedule them to do it, a couple weeks apart from each other. When we're doing suture removals for one previous procedure, we'll do the next excision for the next skin cancer, and so on and so on.
No, I think this has been super interesting, because I think it affects people in their daily lives among lots of things, whether it's getting a skin cancer removed, whether it's a little neck lipo, whether it's facelift. So definitely more stuff to come. And Andre, hopefully you'll come back and talk about some more either facelift or eyes under local. That would be another great topic for us.
Yeah.
Always happy. No, it's a pleasure.
But before we wrap up today, we got a few quality sections here. So we'll do a little fact or fiction. Andre, we'll start easy. Fact or fiction. We were med school buddies together.
That's right. Fact.
Fact or fiction, because I feel like I remember this, that we ended up rooming together on the interview trail during med school and ordering like Emo's Pizza in St. Louis when we got in at like midnight for our interviews the next day, because we were delayed like 16 times.
That one, I don't know. I think I'll fiction on that one. I got one for you, which may date us, but what years were we at medical school together?
Ooh, we were there in 2002 to 2006.
Yeah, it's been that long. Wow.
Damn, it's been a little while. Well, we do a section that we like to do called Behind the Bovie. So can you tell people what's one thing that nobody kind of realizes or sees about office-based procedures that's kind of a cool little nugget that they would never know, but you're like, damn, this is kind of interesting?
Put me on the spot here, but I think the cool thing is, honestly, the coolest thing I think is doing, say, like a facelift. Totally one medication with some Xanax and local, and having the patient talking to you while you're doing it. That was probably the coolest thing that I've incorporated in my practice in the last couple of years. And honestly, it was from my experience in Birmingham. I got to train and work with some awesome faculty there as my mentors, and Louis Vasquez was doing this in Birmingham, as well as many other impressive things. And they're not the only one. Musto of Northwestern, a lot of people have done aggressive plastic surgery under local. And so, I think you get out and you're a little tentative at first, and as you do more and more, you get a little bit more comfortable. And the first patient I offered it on actually was a patient that had a facelift already and said, you know what, I want another facelift, and I'm totally fine with you doing under local anesthesia. So it was really that patient who was like, go right ahead. Worst case scenario, you can't do it, then we'll go to the surgery center. And so after that, it's been...
You're like, if I can do this revision facelift, I'm good.
And the variations of the facelift techniques over the last few years has also gone to a more deeper plane, which I thought was really... very difficult to do. Actually, it's a little bit easier because of the planes of the face. So that part's pretty cool. So I'll probably be doing a little video, so I'll be happy to have folks take a look at that. But coming up, actually in 2 weeks. So
awesome. That'd be exciting. And then, for anyone who listened to episode 26, there may or may not have been a belly flop on the quote of the day. So I don't know if Gilberto is going to redeem himself or if he's lost privileges and celebrities taking over. P.S. on that, Gilberto had to do it because celebrity forgot.
Oh, come on.
I can try to redeem myself. I think I got a good one. It certainly...
Is it an
confidence
is it an anything one, or we're done with that?
It's certainly much better than the last one. I tell you that much. It's much more comprehensible.
Okay, let's hear it. Let's go.
All right. So I don't know if you guys know who Lee Jun Fan is. He's also known as Bruce Lee. But Bruce Lee once said, "A wise man can learn more from a foolish question than a fool can learn from a wise answer." Really?
No, I mean, I just
That was the thing.
can we just go back
Mine
to,
is,
how can the sky be the limit when there's footprints on the moon? Can we go?
There we go.
That was my golden nugget. That was like my little
Yeah, I feel
ace
like
in the hole.
I feel like you came strong too fast.
Yeah.
I have one that is in the spirit of first NFL Sunday of the year. Lou Holtz said, "Virtually nothing is impossible in this world if you just put your mind to it and maintain a positive attitude."
Boom. That's what I'm talking about. That's what I'm talking about, Gilberto. Just like that. Just like that.
Sorry, man.
Well, Dr. Levesque, thanks for coming on. I appreciate it. I think this was super, super helpful because I think people have thoughts about this. I know we get questions about it all the time, so it was kind of nice to dive in a little bit deeper. Celebrity Cast, appreciate it as always for you guys taking out a little time of your weekend to educate the world. So thank you. Feel free to download us on iTunes or wherever you get your favorite podcast. You can also find us on YouTube. So check us out, Plastic Surgery Untold or under Austin Plastic Surgeon. So Andre, tell us your website and your Instagram handle just for people listening.
Yeah, so it's just Dr. Levesque. You have no way of knowing how to spell that, but certainly it's Levesque, and it's LevesquePlasticSurgery.com.
Boom. There it is. Thank you, guys. The greatest podcast in the world, as voted by us, Plastic Surgery Untold. Thanks. See you guys.
See ya.
Thank you.